I'm a medical student, and in first year I lived in Marano Street Halls in the student village, and it was in a very, very poor area of Glasgow called Maryhill. And as soon as I got there I realised that Maryhill is a hugely poor area, and we weren't even in the poorest area of it, but on the way to sports every week you'd go through the area and see just how deprived it was. But just about 10 minutes walk further was an area of Glasgow called Bearsden, which is one of the richest places in Scotland, and it was completely different there. And it made me wonder why this was, and it got me thinking about the health of the area. What I thought was, and then as a medical student I was lucky enough to visit patients in both in Maryhill and in Bearsden and neighbouring areas, and it was quite interesting to see the divide between the two. And I think it is a lot to do with wealth. The patients there weren't able to. Some of them weren't able to go private. Some of them weren't even able to buy, the better quality foods. So there was a lot more heart disease, like a much more higher salt intake in the diet, and especially with education as well. I thought that was quite important. The local schools, especially in Bearsden and areas like that, and Mulgai, were educating their children and the students a lot more to do with health promotion, whereas these schools in Maryhill, lots to do with wealth as well, weren't able to educate their children on these matters, and it shows just why, unfortunately, these the patients nowadays have grown up to have life expectancies about 15 to 20 years, sometimes less.